Steps are to be taken to implement measures to punish schools and school officials guilty of breaching the local HIV policy in schools. This was revealed by Prime Minister Bruce Golding as he addressed participants at the World AIDS Day annual Outstanding Leadership Breakfast, which was staged today in observance of World AIDS Day. Kingsley Roberts says more.
It was a furious Bruce Golding who expressed alarm at reports that some school officials have been disregarding the HIV policy for schools aimed at tackling stigma and discrimination. He lamented that there is presently little that can be done to ensure compliance with the guidelines. That, he stressed, must change.
That even though the policy is in place, there are individual schools, and more particularly individual principals, who are choosing to ignore the policy and exercising their own authority as principals to violate the policy. And I heard a suggestion that, quoting an official of the Ministry of Education, that there is not much beyond moral suasion that can be done, because even though it's part of the policy, it's not codified, it's not part of the regulation. Well, if that has been an oversight, we're going to fix that.
He added that he will be speaking to Education Minister Andrew Holness on the matter, lamenting that affected children, already overwhelmed by the disease, have to face callous discrimination. On the issue of the National HIV/AIDS policy, he said while that already exists, other key legislation needed for the framework still need to be passed.
Well, we have a national HIV policy which is in place, but derivatives of that, which involves, for example, the workplace policy, which is before Parliament now, and Pernell, I know we have to respect due process, but I think it's important for us to ensure that those deliberations are concluded as early as possible, so that we can bring that policy into effect.
Citing that there are indications that Jamaica is coming to grips with the problem, he lamented the fact that some 14,000 persons in need of antiretroviral drugs are unable to access it. Mr. Golding underscored the need for the Health Ministry to finalize plans to access cheaper drugs.
As tough as things are, and we have challenges, but it is something that the government is going to have to be prepared to continue to provide the necessary support, including fiscal support, that would enable those persons who need those drugs in order to live to be able to source them. And I'm anxious for you to confirm to me that those arrangements are in place, and we may be able to expand significantly the number of persons who have access to these drugs.
Kingsley Roberts, CVM News.